I have now the great pleasure of introducing Manny Moodley, our CEO at Retina South Africa. Manny always says that he grew up in Retina. He always tells us that he remembers being an 8-year-old going to Retina meetings and assist with tin shaking and fundraising efforts with his parents. And he has now graduated to now for more than a year serve very distinguishedly as our CEO. And he's just come back from the marvelous Retina International Conference. So he will give us a little bit of an overview of what was talked about at the conference, and also some plans ahead for Retina South Africa. Thank you, Manny, for giving us your time.
Thank you so much, Marisa, for those kind words. Really, really excited to be here. I'm going to quickly try and, in a nutshell, encapsulate what the recent United in Visions conference was all about. It was, I think, absolutely just amazing, mind-blowing. And I think, the themes throughout it were really amazing. There was breakthrough science, terrific technology, hope and solidarity, with themes that ran through the entire conference. There were about 650 delegates from all over the world that attended the conference, and it was absolutely amazing to connect with these people from all over the world, different eye conditions, different organizations, some private individuals, some corporate, some from a non-profit. Absolutely amazing combination of delegates. And we got to then engage with the researchers and clinicians, people from industry who were there presenting and exhibiting. And it was absolutely amazing to see the great work that is being done and the solidarity of this retinal community at an international level. And I got to address the Retina International membership on just that. I think the togetherness that we share when we attend these events. And I mentioned to them, one of our South African concepts of Ubuntu, I am because we are, which is really something that I think took fire there, and everyone really enjoyed that description and concept, because that's really what the retinal community is about. We all work together very closely with these clinicians, researchers, scientists, and just like Professor Marshall and so many others, they are accessible to us and very keen and helpful, and want to talk and engage with the patients, which is amazing to see and experience. The science component, for those of you that followed online, was absolutely staggering. We are moving forward at such great pace at the moment, and at Retina we always say treatments are in the near future, and it has really become that. It's very near future, I think, now. And Michelle Michaelides, who was the speaker at the close of the conference, I think encapsulated it very well, where he said that, always been sort of cautiously optimistic, but now he says it's time that we drop the cautiously. So now we are optimistic. We are on the cusp of treatments, more treatments coming through. We have, of course, one treatment in Luxturna, but they have advised that in the next 2 to 3 years we can expect at least 2 more treatments to be registered, which is absolutely amazing. It's absolutely tremendous. And it's not just happening over there, sort of in the US or in Europe, but South Africa, we were involved in a very instrumental trial, which is now under the Tinlarebant that Claudette mentioned in her talk. And that is one where South Africa was one of 20 global clinical sites, and we were the highest ranked site out of those 20 sites. And we had Stargardt's patients from South Africa attending and really, I think, contributing to this progression of this treatment that is imminent. It has been registered now or has been submitted to the FDA in America, and imminently we will hear some very positive news on that we are expecting. So yes, brilliant stuff from a science side. I don't want to touch too much on that. Claudette mentioned, I think, some of the great stuff that's going on. But I want to talk about the other element of the conference. One of the very important ones that we covered this year was mental health. And I think in South Africa, haven't really spoken about it as openly or as frequently as we should have in the past, but we are definitely putting a higher focus on it now. But from an international perspective, there's been a lot of research done on vision loss and people who are blind and visually impaired and what they go through in their lives. And it's absolutely astounding. The statistics from these surveys shows that there is tremendous isolation within the low vision community, and that isolation leads to higher levels of anxiety, depression, and even suicidal ideation in a lot of cases for people going through these conditions. And it's absolutely staggering to note some of the figures. And that's where we need to step in, and we really need to put a focus on it, to highlight it, and let people know that you are not alone in this. We are in this together as a community, as a group, and it's us here in South Africa, and we are connected with the international community as well. So there is a lot that we can look forward to and a lot that we can be hopeful for. And that is what we at Retina South Africa want to focus on, that hope for a brighter future. With regards to technology, which was another strong theme at the conference, we had tremendous exhibitors there exhibiting apps that you can use that would navigate you through public spaces like airports, conference centers, shopping centers. And this is called Good Maps, and it's available currently in the US and in Europe, but they are expanding to parts of Africa as well and mapping it. So you don't need to have special equipment, you just use your phone, punch in where you want to go, and it will literally take you to the doorstep of where you want to go. If you're in a hotel and you punch in room 125, it would literally direct you through a safe route to your door. Things like that are available and being used in the US and in Europe at the moment, and we can expect them to reach us in the near future. So we are very excited about that. Also in America, things like Waymo, for example, which are driverless vehicles that are actually operating on the roads. I mean, just like we would book an Uber here, you can book a Waymo in the US, and this car will just roll up there, and with no one driving it, no person driving it, and you just then get in, go to your destination. It's absolutely amazing, and still there's a few kinks we need to work out to get that operational in South Africa. Number one, I think the taxis here might cause a bit of an issue, but yeah, that's one of our issues. But it's just amazing to see the technology and the development that is happening at that level. With our focus here being so much on patient support, we want to now try and engage more with these technologies. And I think Ferdy coming up, speaking about Umsizi, is definitely one of those technologies which is developed locally here by one of our own members, and it's absolutely amazing to see and experience and be a part of. So we are really, I think, in good stead, working greatly towards wonderful tech in our own space. So it's absolutely amazing to see. What we felt was a real, the entire conference, like I mentioned, 650 delegates from all over the world, all coming together and really just driving things forward. And that I think encapsulated it really nicely. Togetherness, at that conference. Absolutely amazing to be part of that community. And I think what we want to take forward in South Africa ourselves now, as we look forward, is to engage more with our membership. These sorts of meetings, member gatherings, member meetings, we want to have more of those and roll them out through the rest of the country. So we already have upcoming events in KZN planned for next month, August. We will be there and we will host a similar sort of member gathering there to engage with our members. We have been in Cape Town not too long ago, and we are planning to go to the Eastern Cape as well later this year. And I think that's about rebuilding those footprints in these provinces. We have a strong Retina team in Gauteng, with our head office being here, but we need to rebuild those footprints in the provinces. The members are there and ready and thirsty for information and engagement. So I think we really want to put a focus on that going forward. And that's where I think we really want to engage with you out here in the audience and online as well. If you are interested and wanting to get more involved, please reach out to us, and we will give you the tools necessary to actually create those support groups and little communities wherever you are, so that we can grow that footprint together. This is a Retina South Africa meeting, an AGM, but for you guys in the audience, it's our meeting. It's our meeting. We are all together, and I think together we can really grow from strength to strength, and make a more impactful, positive change to the lives of our members. I also would like to just highlight the expansion to the Retina team, which was mentioned earlier. We've had tremendous growth within the team over the past year, and we've brought on quite a lot of new staff members over the last 3 months specifically. There's been quite an exponential growth, and these staff members are to take us to new levels, to reach new areas, to cover new dynamics that we might not have been touching previously. So it's really a very exciting time for Retina. And we encourage you guys to get involved and engage with us as we grow. What we want to bring through is things like surveys and member engagement polls and that sort of thing. So that's where we count on yourselves to actually get involved and let us know what you want to hear as well. And we are happy to bring it to you. And we hope to do that to the best of our ability going forward. So like I said, it is not an organization for myself or the staff. It's our organization as the retinal community. And it's really, I think, encouraging. The comments and the attendance here at this AGM is really, really encouraging. So we hope that we will see more engagement and communication from yourselves going forward, so that we can bring you what you want. But now I think I can hand over to our next speaker. That is Carol Baum.